ones upstairs? Are we wanting to breed them or no? But I'm asking, like, are we eventually gonna want to breed them or no?
Yeah, you're gonna want to breed those?
Oh yeah. Yeah, I got it.
This is what we in business call a market fit. What is it? People to come to America where healthcare costs twice as much per person as anywhere else in the developed world. Volatility associated with our current insurance system for small and mid-sized employers is untenable. It cannot continue.
Let's control healthcare costs. Let's move the rest of the industrialized world on. Let us pass a single-payer national healthcare system. Thank you.
Who was that young guy? We've got a panel now to discuss an aspect of our healthcare system that does not get enough attention. And that is, what does it mean when we spend $10,000 per person on healthcare? What does that mean to the business community? What does it mean for the overall economy? What does it mean for international competitiveness when we're spending so much more than other countries that guarantee health care to all people? And we've got a great panel to discuss some of these issues. Let's start with Richard Master. Richard is the founder and CEO of MCS Industries in Eastern Pennsylvania. And this is a company which does about $200 million a year in business. And for a number of years now, he has been very active in the fight for single payer. Richard, you're a business guy. Why is single payer sensible to you and to the business community?
Senator, about 5 years ago, after many, many years, 10 years of volatility in cost and demands from insurance companies annually for increase in premiums, I realized that this was something that I had to get involved in as a patriotic American. Our company employs 180 people in Pennsylvania and throughout the United States. Our health care bill is $2.8 million a year. It costs $27,000 to insure an employee with a family. That's $13 an hour, $13.50 an hour, which is, if you put this into context, it is about as much as 1/3 of the population can't make in a year. So this is an outrageous cost. We're beyond the tipping point at this point. We have really got to do something to control costs. Now, we look at the Medicare for All solution. Right now, we are spending about 18% of payroll for healthcare costs, for health insurance. We look at Medicare, the model for Medicare.
Yep.
All, it's 10%. We could be saving tremendous amounts of money, and we would be relieving our employees of the anxiety of maybe not being able to pay their deductibles and copays.
As an employer of a couple of hundred people, how many people do you have?
180.
180 people. What would it mean to you to know that every one of your employees had good quality health care, and it's not an issue that you have to spend half your life worrying about?
It would mean so much to the spirit of our organization. We're a caring company. We provide scholarships for our employees to go to the community college and other colleges and to their children. And we see day after day employees that are threatened with bankruptcy. Now, what we have done, we've had insurance policies, and then we have a secondary insurance policies that takes care of the deductible so that our employees don't have that anxiety. But that's the reason for the massive expense. The $27,000 a year, that's approximately the cost for average cost across the country for a family of 4 in this country.
Are you finding more and more people in the business community going beyond ideology and understanding that Medicare for All would be a good policy for them from a business perspective?
Yes, we're seeing that. We started an organization called the Business Initiative for Health Policy, and we're getting substantial support for that. We started another organization called Business Leaders Transforming Healthcare. In California, we have 300 members, business members, for the Business Alliance for a Healthy California.
You take that one.
We have other memberships, 200, 300 members across the United States. New York is starting an organization. Ohio is starting an organization. Yes, there is momentum.
Okay, let me jump to Jen Kimmick. Jen, you and your husband co-founded a brewery, Alchemist Brewery. You have about 50 some odd employees. What does this current healthcare system mean to you as a small, medium-sized business person? Hold the microphone.
We provide health insurance to all 50 of our employees, full health insurance for employees, their children. We cover half for spouses. My husband and I do this for 3 reasons. The main reason is because we believe everyone should have access to quality health care. Simple. The second reason is it's just a plain good business decision. When our employees are healthy and when our employees' families are healthy, our business does better. Morale is up and productivity goes up. And the third reason, and this is really important, is we can afford it. And I say that because it took us 8 years of business before we were able to afford it. We spend $300,000 a year now on health insurance. And our employees don't have the best health insurance. We have what is considered a great plan. It's a silver plan, but the deductibles are high, the co-pays are high, and the out-of-pocket expenses are high. So we spend all of this money, and our employees still don't have the stability they need, and they still don't visit the doctor when they need to.
Jen, what would it mean to you running a business in a competitive industry if all of your employees had health care as a right, and you could worry about making the best beer in the country rather than providing health care?
It would be great for our business because, again, our employees would go to the doctor and get the medicine they need and get the treatment they need. But it would also level the playing field for all businesses, especially small businesses. Vermont, like a lot of states in this country, are really small business states. 90% of the businesses in the state of Vermont have 20 or less employees.
And it seems to me you're trying to do the right thing from a moral perspective. But if you're competing against somebody who has a different point of view, am I mistaken that you're in an economic disadvantage?
Absolutely, absolutely. And it's harder to compete with recruitment and retainment. Yeah, it would level the playing field for all businesses. And then I would also add that while there are a lot of employers that can't afford insurance, there are a lot that can and simply don't. And so when we're covering 50% of those spouses, we're covering bigger employers that just are not willing to change.
That's an interesting point. Our next guest needs no introduction to some people, at least. Dr. Don Berwick was trained as a pediatrician and served in the Obama administration as the Director for Medicare and Medicaid Services, the head of CMS. Don, let me ask you, start off with a simple question. You ran Medicare, you ran Medicaid for the United States of America. My understanding is that the administrative costs for Medicare are somewhere between 1% and 2%. Administrative costs for private insurance vary 11 to 15, 18%. Why is Medicare so much more cost effective than private insurance?
Yep.
Because the only thing we're trying to do is stand up for the Medicare beneficiary.
Actually,
No
trying to make a
billboards,
quick,
no
like,
high salaries,
roll run through of all
the
our-
complexity of the health
all
of the
the stuff
system
we've
just isn't there.
built.
It's simple.
To make a
I
little
spent
video.
the bulk of my career, I'm a pediatrician, but most of my career has been spent trying to figure out ways to improve quality and lower cost in healthcare all over the world, not just the U.S. And what we got here is insane.
Is that a medical term?
You know, we are, like you said, double the next
The last
most expensive
15
country. Our
minutes
life expectancy is
of my
31st
gameplay.
in the world. Our infant mortality is 38th in the world. We have an underperforming system at extremely high cost. And this, you heard from the business side what that does to business. What it does on the public side, you know better than me, Senator, but in my state, Massachusetts, every line item in the state budget has gone down steadily in 2 decades. We parks and recreation is down 50%, education is down 20%, you name it. Law enforcement's down 20%.
Because we're pumping more and more money to escalating healthcare costs.
52% increase in healthcare costs in the same interval from 2000 to 2018. So this is confiscation. This is healthcare taking money from businesses that need it, labor that needs it, and public services that need it. And it's wrong. And
All right, let me ask you this. You ran Medicare for the Obama administration. Medicare is, in fact, the most popular health insurance program in the country. Is there any reason, in your judgment, why we should not expand Medicare, which now covers people 65 and older, to every man, woman, and child in this country?
no, there's no reason. It just will. Running Medicare, I didn't run Medicare for all. I ran Medicare for Medicare. But it's a privilege. You get to go to work in the morning. There are 50 million Medicare beneficiaries, 60 million or 70 million Medicaid, and you figure out what they need. And it just makes sense. Well, we need transparency. We have transparency. You can find out the prices. You need prevention. We shifted money to prevention. Before and since the Affordable Care Act, you need chronic disease care. You need a nutrition program. Medicare can do it. When I get a report from the Inspector General saying that we're over-sedating people in nursing homes, the next day I was on the phone with the nursing homes and the geriatricians said, you stop it or we'll stop it. You can stand up for people. Why wouldn't we do that for all Americans, not just people over 65?
Okay. Let's jump to a video question.
Hi, Senator Sanders. I'm Andy from Washington State. My question is, if Medicare for All will pass, would the tax increase be more or less than what I'm already paying now for my employer-sponsored plan?
Thank you very much, Andy, for that question. As a recipient of 30-second ads that